Welcome to the My City, My Health podcast, where we are having real conversations about public health, community wellness, and the work being done to create healthier communities. Now, each episode, we sit down with thought leaders, change makers, and advocates to explore solutions that are making a difference. Now, don't forget, My City, My Health is hitting the road. Join us for our next conference on April 18th at the University of Iowa. Students get in free. You can register and find out more at www.mycity.health. Now let's get into the conversation. Hello, everybody. Thank you for listening to the My City, My Health podcast. I'm your host, Corey Dion Lewis. And today I'm very excited for our guest. She is one of the panelists at this year's My City, My Health Iowa City conference. I don't want to pronounce your last name wrong. How do you pronounce your last name?
It's Gadag.
Awesome. Hey, thank you so much for being here. I really appreciate your time. Before we get into our conversation, can you tell me a little bit about yourself, your name, who you are, and what you do?
Yeah, thanks, Corey, for introducing me. Hi everyone. I'm Khyathi Gadag. I am currently a PhD final year candidate in the Department of Health Policy and Management, College of Public Health at the University of Iowa. Predominantly, my research is around mental health, substance use disorders, policies around that, healthcare access, telehealth-based policies to cater for mental health, to improve mental health access, essentially, and also around social determinants of health. So those like my research interests. And also, I would love to give some background about myself. I'm originally from India. I have been there all my life, and I came to Iowa City 5 years ago to pursue my PhD. Previously, back in India, I had been a dentist, and then I transitioned into doing health administration and was an assistant professor for 4 years. And now here I am, almost at the tag end of my PhD. So thank you so much for having me here, and I would love to converse more.
Yeah, and I want to get into the panel and that stuff. I'm so interested in the change between what you were doing before and the switch to mental health. What made you make that change?
Yeah, I always get to hear that. Like, what made you go from clinician to like dental clinician to mental health? So I distinctly remember that during dentistry, we had these oral surgery and prosthodontics, that is very dentures for older adults and things like that. And I have seen a pattern of correlation between mental health disorders and dental problems. So that was something which was very evident, and we also did some studies and research on how mental health is a contributor to physical health problems, including dental problems. That's when I went deeper into how mental health disorders can eventually also lead to physical health issues, and that's what made me so interested in mental health and in the administration side of how can we improve mental health access, how can we prevent mental health problems so that we can holistically address physical health disorders. So that was where my interest stemmed from.
That is so cool, and we need more of those approaches and need more of that action here. So that's great. We have somebody doing that work. As a doctoral candidate in health services and policy, how do you see holistic approaches to mental health fitting into broader healthcare policy discussions?
Yeah, so I would put this under two different buckets. The one being the preventive aspect, which I heavily advocate for, where we think about integrating mental health care into primary health care, having collaborative care models, and behavioral health integration models into primary health clinics and things like that, so that we can get to the actual issue even before it becomes a mental health illness. So that kind of approaches, just based on my policy research, looks like such approaches can help us prevent mental health burden in the society. And another one which I really think we should start focusing on is the social determinants of health. They're one of the biggest determinants of mental health problems. Going beyond clinical interventions is also trying to focus on non-clinical issues, like for example, food insecurity, housing problems, low income individuals. So all of these social determinants of health can be a very useful determinants which would lead to mental health problems, and addressing those can in turn help us address mental health problems. So that's something that the policymakers and policy advocates of mental health should start thinking about. And I think we are going in that direction where we are trying to address social determinants to address mental health problems. So that our overall physical health holistically is good. A lot of Medicaid, Medicare policies are now gearing
Mhm.
towards um, reimbursing these services and assisting these services, or having some kind of reimbursement and coverage for categories of populations that fall under these vulnerable populations. So that's another very important way to holistically address mental health through policy and healthcare advocacy. And the next part of it is obviously the curative, when we actually get the uh, when we are diagnosed with a depression or anxiety or any other kind of ADHD disorders, and that's when the curative aspects come into picture. And a lot of research and my personal research is about improving the access to care in terms of how are the patients even getting the first step and the first foot inside a mental health clinic. The reimbursements, the coverages, they all play a very important role. And it's just not reimbursing the actual treatment, but also reimburse right from the beginning, like preventive disorders, and then curative is the mode of channel that I think we should take. So yeah, in short, integrated with physical health, because physical health is not different from mental health. So have the integrations going on with primary health clinics, and addressing social determinants of health would be very, very useful.
Yes, 100%. I appreciate what you said about housing because there's a lot of information, a lot of data out there that shows how the housing and kind of the access to healthcare or that healthcare, um, how that really supports the person when they have appropriate housing. And
Yeah,
we're seeing a lot of new developments come up for housing for individuals who are unhoused or things like that. So I'm really interested to see how that helps
for sure.
going forward and what that looks like. If there's a way, and maybe you can tell me a little bit more since this is your wheelhouse
Yeah.
on if there's a way of being able to track those who were unhoused and now have a safe and secure housing situation and how that is affecting their mental health care and their access.
Yeah, the first thing to start with is having a roof on your head.
Yeah.
That itself is a big thing. Like, imagine the amount of stress when you are homeless. That's a lot to deal with. And it's just not about having a home. Also, what kind of conditions you're living in. Is the
Hmm.
plumbing facility good? Are you getting good ventilation? And are you in a neighborhood where you feel ventilated enough? You have your groceries and everything around you. So also not just the house, but where you're located also plays a huge role. So everything together plays an impact on mental health problems. And if you talk about specific housing, I think it's very important. Think about the new technologies, for example, like telehealth is such an emerging thing, like since
Hmm.
COVID. Imagine not having a house. How would you ever even get a telehealth visit to start with? So that's a barrier to even get a telehealth visit, considering that telehealth has been useful for rural populations, remote populations, and you're in a rural health setting, sorry, in a rural area, and then you don't even
Hmm.
have a housing situation. That is like, it's just compounding your issues of not able to use these innovative technologies that are specifically meant for improving access. So if we start talking about it, there are so many things around just housing and how important it is to live in conditions and housing conditions that are good for both your mental health and physical health.
Yeah, 100%. And you are the founder of Here to Help. Can you
Yeah.
tell me about that? What was the why around starting that, and tell me what do you do with that initiative?
Yeah, yeah, that's a good one. So yes, 2 years ago, I was serving as the mental health director at Grad Professional Student Government, and then one of the first things that I realized in my meetings with different kinds of people and populations in the student populations of University of Iowa was they're so uniquely placed, and everyone had unique needs, and the only way we can actually help them is by having an organization led by students, and that's Here to
Mhm.
Help. where we can assist and help and connect them to the university level resources, because university does so much around mental health and the resources are placed at different places, and we have observed the awareness gap between the students and what the university is doing. And here to help can be that bridge to make sure that the students are aware of all the mental health resources and support available at the university. That's one of the major driving forces. And we also saw that the colleges, especially graduate professional colleges, are pretty siloed and they're very
Mhm.
differently placed. So having organizations like Here to Help in each college and having them associated with the University Counseling Center and other key mental health organizations of the university will be very useful for the communication flow between these organizations and the students. So that was one of the driving factors to have this organization. And also within the college, they have such unique needs. For example, you take dental students or medical college students. They are providers themselves, and they have different kinds of mental health concerns which have to be addressed uniquely to them.
Mhm.
So that's one of the other reasons why we started this notion of having Here to Help in different colleges. Right now, we have it in College of Public Health, and I hope in future most of the colleges start adopting this, and that was the driving force behind this. And when we have limited scarce resources, it's a known fact that healthcare providers, and there is a professional health professional shortage in mental health provider side. And in such conditions, coming up with something like this where students supporting students and even employers supporting their fellow employees and things like that will be very useful in different setups of peer-led initiatives. Not just student but also beyond that will be very useful.
Yeah, and can you talk a little bit about how you guys tackle stigma, around mental health or reduce stigma?
The first thing to reduce stigma was to have a dialogue around it, to keep the dialogue going within the college or within that area or your campus or your employment setting. Just talking about it, having posters put up, having monthly activities where you come and you talk about your mental health concerns, or you have some kind of town halls where you discuss about things like, I mean, invite, for example, invite experts in mental health, like from the university counseling centers, arrange some town halls, do some kind of Q&As between the students and the university leaders who work in this area. So having a dialogue in itself will help minimize stigma. And we should also be very cognizant that mental health problems are also very culturally sensitive, and
Yes.
different cultural backgrounds have different perceptions of mental health. And keeping all that in mind, we can also have some similar groups involving with each other, uh, someone leading those discussions from the same cultural background. So having small group discussions on mental health within the university or within the college will be extremely useful to help prevent the cultural aspects of stigma.
Yeah, and that was my next question to that was because not only are you dealing with different cultures, but it sounds like the population that you serve are those that are really trying to reach a certain level in their career. So they're already focused and they're in thinking about their mental health may not be the first thing they're already thinking about because they want to work hard, hard, hard and keep going and going and going. And we'll just think about that later.
Yeah.
You know? So how do you deal or have you had any experience with one, the stigma of mental health, but also that person's culture and background, and on top of that, them being highly focused on success within their career and within the population that you're serving there?
Yeah, and you're so right about highly focused on their profession, their academics, especially grad professional students are so hyper focused that they tend to avoid their mental health. And
Hmm.
that creates a lot of depression, anxiety, and things like that. So you hit the nail when you said that. And hence we need to give them reminders. Like take care of your mental health. And one thing that is very important is training. Suppose we have this Here to Help organization where there are a group of members working as leaders of the organization. I think they have to be trained in in a way that they can identify their colleagues or their fellow students who are going through any kind of mental health problems. That will be very useful. Peer-to-peer training is something that can be really useful in a way of recognizing, like, oh, my friend is going through something, or my colleague or my fellow student is going through something, and recognizing that itself will be very useful to start with. And there are patterns when you know that a person is overstudying or overworking and ignoring their mental health problems. So the peer-led initiatives will help getting those into place. Maybe someone would be more free with their friend in sharing what they're doing rather than with a professor or a mental provider themselves. So it can go either way as well, but then those
Mm.
can be really useful. And when you said about this being hyper focused and avoiding mental health, I think just having those kind of talks and then having little activities around you. The activity can be as simple as displaying an art.
Mm.
Just take 1 month of the day and then have an art display by students, and that will take their minds off the studies and motivate them to do it. Put some awards like any cash prizes for someone who wins it and something like that, where you can engage them. And I also feel a huge role of the faculty, teaching faculty, because they're the first point of contact. So when those situations take place, it's nice for a faculty to come and say like, hey, are you taking care of your mental health as well as your studying?
Mm.
As you're progressing in academics, even that little check-in from your professor or your teacher by saying like, how are you doing mentally today? Just start with that. Or how are you doing physically today? I think that will really make a difference in students' life.
Yes. So there's a saying of do as I say, not as I do. And I know a lot of practitioners, I am a clinical health coach, and there are times I will tell a patient something and I myself will do the total opposite of what I
Yeah.
told them. So how do you maintain your mental health as you're doing all the things that you're doing?
Yeah, see that's the toughest question of tonight today. That is the most toughest question I have to answer. No, I used to be a workaholic before, but I think I kind of changed my ways after I entered this field. Um, One thing is I make a conscious effort, like once I'm home and once it's like beyond 6 o'clock, try and not look at my Outlook or any kind of
Mm.
things, so that I have that work life balance. I can spend some time with my husband, with my dog, and just talk to my parents and things like that. So this consciously I have to make an effort of not just overworking. And frankly, as a final year PhD candidate, I do have to do overwork. But that's just that time, like the final dissertation defense month, probably. But then otherwise, the rest of the time, we need to consciously make an effort. And I did that. I consciously made an effort. I watch a movie because I like watching movies. So I watch a movie, like read a book, but consciously take out that 1 hour and invest in yourself. And if you like self care, I do that. I love self care. I like some mani pedis and all that. So take out time for those things also are like super important, where you just wanna get relaxed, and it takes a lot of effort. It's not easy. It takes a lot of
Right.
effort. Conscious effort is what is needed.
No, I love that. In your experience, what are some challenges in implementing holistic mental health approaches, and how can they be overcome?
Yeah, so I would like to talk about this in a more broader perspective, that is healthcare services and research perspective. So we live in a very fragmented mental health and physical health situation. So one of the challenges is bringing those together. Like if a person is coming to you to your cardiac clinic, for example, having a questionnaire that talks about their mental health and just seeing whether there's any correlations or even understanding the mental situation would be very important. Hence that fragmentation should become integrated. So mental health and physical health should go together. That's one challenge that I can think about. And on the healthcare side, of course, we're facing workforce shortages. There are a lot of these health professional shortage areas, specifically around mental health. So tackling that would be very useful. And even if we cannot really increase the workforce, we should think about initiatives like peer support, training different kind of psychologists to adapt for these situations. I think those would be very important. And taking a prevention kind of route rather than a curative route is extremely important for mental health, because we want to stop it at the early stages and not at the latter. So that would be another challenge where we need to shift focus on preventive mental health treatment which is probably finding the early signs, and that could be very well done by integrating it with the primary care clinics and things like that, or the primary care physicians, integrating mental health as a part of their screening and things like that, which I think has started happening now, to a lot extent, but then that'll be useful. And if you think about stigma and cultural gaps still exists, specifically having more culturally competent mental health providers is very useful, because they like I just said, they're different cultures and they perceive mental health differently. So multilingual providers, culturally competent providers is something which we should still up our game in that area. Lastly, since I do a lot of technology, digital health research, there is a digital divide which we need to minimize.
Yes.
Specifically, when we talk about telehealth, which has come up so much in the last 2 3 years, a digital divide can probably worsen the disparities in mental health treatment, where you have rural populations and things like that, where you need to train them to use it and things like that, and all of that. So digital divide is another critical situation, and yeah, all of these things culminate together when I think
No,
about challenges.
100%. We could have a whole nother hour of an episode talking about the lack of um, people of color within the profession, and how there's a supply and demand issue there, and like, and how do you do when you what do you do when you need folks that are culturally competent or culturally aware and being able to provide those services. That can be a whole nother episode of what we can do with that. And it's funny you bring up the digital health, the divide there, because I was just researching, this was about a month ago, about there's an organization that they have digital health navigators, and I've never heard of that before, but there are people that will help those who are in that divide, help them navigate this digital health world. And I think that is so innovative. Um, and I think it is something that we need to see more of, for sure.
Yes, and I just want to add, like, in college campuses and even in other employment areas, I think when I said peer led initiatives, one of the things that we can do is have these navigations, have students help their peer students, or have different employees help their peer employees in understanding digital health, in understanding telehealth, understanding how to use those services. I think it's very, very, very useful to have these navigators, just
Mhm.
to make sure that we get this advancements, uh, and we are up to date with the telehealth advancements.
Yes, yes. And thinking of it, advancements, that kind of leads to the next question. How do you envision the future of mental health care evolving to become more holistic and patient-centered?
Yes, I would definitely start with integrated care, which
Mhm.
I've been talking about, primary care integrated with behavioral health care. And second is, I think focusing on social determinants of health can be a huge game changer at many, many levels. All social determinants of health, if you think about, like we said, housing, the food insecurity issues, the low income, and things like that. So I think it will be very useful to think about from those areas. Uh, and I think also, like, having culturally competent providers, focusing on how do we increase that pool of providers who are people of color, so they can help their people better because they understand them better. So that will be very useful as I think about the future. And now, since now we are in this technology era, I would also put that in place, like think about future of tele-mental health kind of service delivery programs, the wearable technologies, the tracking of mental mood swings and things like that, like wearable technologies that have 24/7 tracking devices on seeing how you're doing in terms of your mental health. And I think all of these together would definitely be the future of mental health. A lot of it will be towards, like, in more like towards prevention. I think that's where we are
Mhm.
heading. So, in short, if I have to say, integrate mental health with physical health, that will be a game changer for sure. Second is treating social determinants of health, ultimately treating mental health problems. And third is making sure that we are up to date with the technology advancements in healthcare delivery, so that that doesn't become furthermore challenge for mental health patients.
Yes, because whether you like it or not, the digital health is here and it's not going anywhere. So we have to go with the technology.
Oh, yes, for
Um,
sure. And,
mhm,
and
mhm.
also keeping in mind that previously we had heavier insurance barriers like parity problems and things like that, but that is minimizing now. But going forward, I think coverage for services and coverage for social determinants of health and all of that together will inform how we are reducing mental health burden in society.
Yes, 100%. So my last question for you today is, what is one piece of advice that you would like to give to the audience?
Yeah, great. I wish I follow this, but then, but that advice would be mental health is literally the foundation of everything. Your academics, your relationships, your personal life, your professional life. I think having that conscious effort to take care of your mental health is very important. And I think make that your priority because work is probably a part of your life, but mental health and preserving your mental health should be a bigger component of your life. So that work life balance is extremely important. And I would also like to say that, as an individual in the society, as a part of the society, it's also very important to understand your peers, understand your colleagues, understand your friends. So having that component of empathy and compassion will really make a difference in a lot of people's lives, and also helping them, just helping them with their mental health problems is something you should start thinking about.
Yes. Th- Nothing more to say after that. Thank you so much for being on the show today. For anybody that's listening or watching that wants to connect with you, learn more about the work you're doing, or possibly connect with you at the My City My Health conference this year, where can they reach you at?
Oh yeah, I can give my email ID if that works. Um,
Yeah.
or yeah, that's
Yep,
that.
I can connect that all in the description of the episode. So if anybody,
Okay.
make it easier for everybody to connect with you.
Yes, and I'm in Iowa City, so just shoot me an email, and then I would love to connect.
Awesome. Well,
Yeah.
again, thank you so much for being on the podcast today. Everybody, thank you for listening to the My City, My Health podcast. I'll holler at you next time.
Thank you, Corey. Thank you so much. Thank you all. It was great.
Yeah, thank you.